Insta HMS. The inventory management system in our software is very comprehensive and very detailed. So you'll be able to keep complete track of all your items, their locations, and stock mean quantity. So in this video, I will quickly take you through the basic flow of the inventory management system. First of all, we'll begin by doing a stock entry. Let's assume you just purchase some things or you just have some stock. So you just want to make a stock entry into the system. So we can achieve that by coming to the menu here. Under procurement, you see stock entry. Then of course you select the store where you are pushing those items into, and the pre-registered suppliers should be there. Let's say from this company, Genet, and the invoice number is something okay, and every other optional details. But let's just start adding the items. So for example, we got paracetamol tablet 500 mg. Of course, you put the batch number and the expiry date, then the MRP, marginal retail price. But although this may not be your selling price, but just put what you think it should be sold at. So let me say for one tablet, I'm doing 50 naira, and then I bought, the rate is that's how much you bought it. So let's say I bought it for 20 naira. Then quantity, we're doing a unit, so I bought 1000 tabs, and that is basically all. You add, see here it's been added. Yeah, so the next item, let's say artemether. Artemether injection, don't know. This is the batch number, expiry date, MRP is 25. Then I bought it at maybe 700. Quantity about 50. You add, and you see the total amount you bought it here. Add, and so on. But let's say I'm done with this invoice. I'm done with this invoice number, so I can save and finalize. System will bring this to notify you that this amount should be the total amount in your invoice. Let's assume you are making a new supply, so click OK, and then it is saved. So now this item is available in your pharmacy store. So next, you might want to see what you have available in that store. So also under store management, you should see stock level, item stock level. So we come to item stock level, then you select the pharmacy. You can search per item. For example, maybe the paracetamol, let me say something like this. You can see all the paracetamol here, and you see the quantity at hand. But it's okay, I just want to see everything. So these are the item names and the quantity at hand, total quantity left in that store, pharmacy store. And you can as well examine every other store to see what is left in them. Okay, in this central store, this all we have there, and these are their quantity available, and so on. You can check per item or everything, even by all these other fields. So that's how to know the quantity left. You can as well check the flow and how a particular item was consumed under store by using stock ledger. Stock ledger. So for this store, I want to see this paracetamol. Let me examine this one in particular. I think I didn't see that. No. Okay, maybe this one. Yes, so I will use this paracetamol because I made some stock entry on this one. So I want to do full history, or you can do from a date range or from a particular checkpoint, but let's just do full history of this drug in this store. So I want to check how this item has been consumed so far. So I want to use paracetamol. I think I made stock entry on this one. So select this. So you can check full history of this drug or from a particular date range or a checkpoint. So of course all the batches. So let me just search. Let me do full history. So here I'm going to make another stock entry, but this supply is made directly to this central store, and the same supplier. This is the invoice number. I'm going to do this entry in units. So this item, the batch number is this, expiry date is the usual MRP and the usual rate. Then the quantity I'm buying 70. Total amount on the invoice I add. Also buy vitamin C. This one, and with this batch number and expiry date with MRP of 10 naira per tablet. The bought one for. So the quantity is 1000 tablets, and so on. So I save and finalize. So now I want to do a stock transfer of this item, because in the pharmacy store, if you check stock level for pharmacy store for this item, notice quantity at hand is 0. We don't have this item in the pharmacy store. It's been sold out completely. So right now, let me just do a direct stock transfer without raising a request for transfer. That is another flow entirely. So let me just do stock transfer from the store management here. Stock transfer. So from central store to pharmacy store. The reason of transfer is stock. Okay. Transfer dates today. I want to load the GRM, but no need. I'm transferring this item, this batch. We have 70 that batch. Remember when we did the stock entry? So what I want to transfer 42 tablets to pharmacy store. Then the vitamin C, bought 1000, but I'm transferring 500. Description, and so on. So let me just save this stock transfer. Now when you check stock level for pharmacy store for this item. You know it was 0 before. So now we have 42, which I just transferred. Let's also check the vitamin C. Yeah, there were some quantity there before. So that is it. You can even check what is left in the central store for this item. Yeah. We'll transfer 500 out of 1000. It's remaining 500. And also let's see what is left here. Yeah, 28. We transferred 50 something. Let me make some more sales. So it's now available. Selling 12. Yeah, so these are the items. So raise the bill. Payment will be made as usual. So to know how the stock has been moving, you can use stock ledger. So for this pharmacy store, for this item, want to check the movement of the stock, want to check full history, or you can pick from a date range or from a particular checkpoint. But let's just get a full history for this drug. So on this day, we made a purchase. Again, that's the supplier, and this is the quantity we bought, 40. On this date, this is a good received note for this transaction, and this is the SB number, our sales bill number. We made a sales. This is a person who made the sales, and to this patient, OP, there is a quantity was given out. This day we made another sales to Sam, inpatient as IP, we sold 39. See, there is another transaction here. So the stock transfer from central store to this pharmacy store. So there's a quantity we transferred. We also made a sales. This quantity 12 to this patient, outpatient, and our closing quantity for this batch is gone, which is 0. For this batch, we have 30 left. That's the final closing quantity for this item. So you can export it in Excel if you want, and so on. So we have closing quantity as 30. You can confirm this from various menu. Let me try batch. I want to see the batch details of this item. So of course we have for this batch it is 0. This batch quantity left is 0. For this batch is 30 as we confirmed there. And if you want to check out, look at it totally, and use stock level. Pharmacy store for this item. Use stock level, you see we're having only 30 across all batches. And so that is how to manage your inventory. So let me quickly show you how to do stock adjustments. So for example, let me see, there were some miscalculations. So this quantity is supposed to be maybe 60. So if you have access to stock adjustment, you can do stock adjustments. In this particular pharmacy store, the adjustment reason maybe to update stock. To do stock updates, then you add the items. For example, this item for this particular batch. So for this particular batch, you can see this is a batch number, this is the quantity left in the batch, this is a good received note when the stock entry was made, so on. So this is expiry date of that batch. So I want to increase it by 40. Let me say by 45. I'll give some remark here and so on. But for vitamin C tab, I want to reduce it, decrease this particular batch. I want to decrease it by 700, 7,000 and so on. So this item, this batch, this expiry date hasn't. We're increasing it by this quantity, and for this we're decreasing it by this quantity. You can adjust, you can delete. So let me just save this. So let's check our stock level again. For this item, so because we have increased by 5 plus 30 that was left, so having 75 and so on. Let me confirm from the batch. For this item, okay, just a single batch. So remember, you can check all your stock level for all the item across in this store. See, for this item, this will have account, this is the quantity, this item, this is the quantity, and so on. Page 1, page 2, page 3, and so to page 69. You can change stock at any time. In conclusion, I'll quickly bring you here to reporting. So this is where you can generate all types of reports, any kind of reports, from financial report, billing report, patient statistics report, sales and issue report, that's the pharmacy items, then the procurement report, store management report, scheduler, dialysis, consultation, diagnosis, patient packages, service, surgery, dietary, dental, clinical, and so on. But for this video, we are going to be looking at just one or two reports. But for the inventory management, there are so many reports you can generate. Doctor wise prescribed versus sold report. That is doctor prescription versus patient's purchase report. Control drug reports, if there are some items you control. Sales item, there are so many reports here, so many. Then the procurement reports. Purchase invoice, purchase item invoice, purchase invoice, supplier returns, pending, replacements, and so on. There are a lot. Then the store management reports, item master, item stock builder, item wise, indent flow, indent item detail, stock transfer builder, stock adjustment builder. That's to see, the details of transfer and adjustments. The stock movements, how stock moves from one store to the other, to be able to get that report to see how a particular stock or a particular item or even group of items moving from one storage to the other. Item wise stock builder, quantity checkpoints, and so on. But for this, I will quickly show you the item wise stock builder. So quickly, this report gives an item wise stock, sum of all batches stock at various stores. Okay, so I'm going to be getting this. Let me add the serial number here. Take it up. Can remove whatever I don't want. The other level, let me remove it. Package size, I may not need it. Remove it. MRP, I may not need it. Cost price, I may not need it. All what I just want to see, item name. Okay, let me remove the store name too. So all what I just want to see is the item name and the quantity in units left in a particular store. So I'll filter by store name. Filter by store name in this store, pharmacy store. Then I generate in PDF. Yes, so this is what we have. For this item, this is the quantity we have in this store, in the pharmacy store. Needle, this is what we have, and so on. Can take it all the way down. Grand total 1,377 items. So that is it. Or I might decide to get the report of all stores, then ask system to separate it by store in levels. You separate it by store name, just like that. Then generate a PDF. Also, you can still generate in CSV, that is Excel, to export it to Excel, and even text. Yeah, so this is it. Filtered by store. See the first store for central store. These are all the items we have, 1 to 10. These are the quantity left in those store. This and this, that, and so on. Then this other central store, LA. These are the items there, and these are the quantity, and this other store, and so on. This is the pharmacy store, and so on. Have any other store name? This is the longest. And this is another store too. Okay, this is the grand total for this. This is another store too. This is what we have there. Service store. So that is the reports part of the inventory. There are other reports too. Other inventory reports too you will love to use. So many. In stock movement. Let me look at stock movement. So let me just arrange it by store name. Okay, let me just generate in PDF. Let me reduce the font maybe to 8. Still big. 7. Manage 7. So this is the report here. Let me zoom a little bit. Although there are not much movement details, but see details such as opening quantity, the purchase quantity within a particular date range. Remember, very important. So purchase quantity, supplier returns, sales quantity, issue quantity, transfer quantity, transit quantity, rejected quantity, adjusted quantity, reagents, that is for lab reagents. You can still manage laboratory store on this software. The net quantity, closing quantity, and so on, item wise. So that is it about this report. And there are other reports too you can get from the system, but let's leave it at this. Thank you very much for watching.